students, we're just going to quickly go over oral care, okay? Let's start with our oral care. Mr. Smith, we're going to get ready to cleanse your mouth and brush your teeth, okay? So Mr. Smith is okay with that. It's always good to assess the oral cavity before you get started. You assess it for any redness, irritation in the oral cavities. If they have dentures or if they have partials, bridges, you want to assess if they're intact, if they're broken, missing, if they have all of their teeth, but maybe they have cavities. So you want to assess for dental caries in the oral cavity, okay? You also assess in the oral cavity for lesions in the buccal area, okay? That's the cheek area. You always want to assess it for any breakdown, sores in the mouth, canker sores, anything. You want to assess for that, okay? So I have a towel here to protect the patient's gown for any spillage. Listen, if the patient can provide the oral care themselves, let them do as much as they possibly can. Remember, we always want to promote patient independence. So we've assessed the patient's oral cavity. Okay, so we have our toothpaste and our toothbrush. So if the patient has no teeth, right, they have no dentures, the best thing that we can do is use a toothette, okay, to cleanse their oral cavity, okay? So we cleanse the patient's buccal area here, okay? Cleanse all of that, okay? You are to cleanse their tongue, the roof of their mouth, their buccal area. And you can also give them a mouthwash to rinse their mouth out with, okay? If they have no teeth, okay? Now, if the patient does have teeth, we want to, again, assess the oral cavity, okay? So let's say that our patient was unconscious. So let's really get into the unconscious patient. So let's say Mr. Smith is an unconscious patient, right? We want to raise him up as high as we possibly can to prevent aspiration, okay? So Mr. Smith is unconscious. So the first thing, of course, I want to do again is to assess the oral cavity using my pen light. And I also want to assess Mr. Smith's gag reflex. Before I put any liquid into the oral cavity, I want to assess for gag reflex. I do that. I assess the patient gags, so that lets me know that the gag reflex is intact. If there was no gag reflex, I need to lay the patient down in a lateral position and make sure I suction every bit of fluid with a syringe bulb. Use that and suction any excess fluid out of their mouth, okay? So he's up high. I turn the head to a lateral position, and I want to make sure that I have a basin here, okay? To collect any fluid that will come out of the mouth when I cleanse it, okay? So again, I've already assessed, and I'm also going to brush. Same thing with brushing your teeth. You brush the biting surfaces first. I am brushing. It's kind of difficult with this thing, but you brush upper, lower, and you brush straight across, okay? Before I put any liquid, you use a bulb syringe. You can inject a little bit of liquid into the oral cavity and then suck it right back out with the bulb syringe, okay? And once you're done with that, you pat the mouth dry and you reassess the oral cavity to ensure that you did an adequate job, okay? Make sure there's no skin breakdown. Make sure you didn't disrupt anything in the oral cavity. So once you're done with that, you're going to apply some lubricant to the patient's lips, okay? You can actually use your finger and apply some to their lips, okay? Because we don't want any skin breakdown on the lips, okay? So care of the unconscious patient, again, sometimes you can have them down in a 30 semi-Fowler's position or in just supine position. Make sure they're in a lateral position with the emesis basin, okay? We don't want them to aspirate, okay? So that is care on the unconscious patient. Now, if the patient was conscious, we want them to brush the teeth themselves if they can, okay? If they can do it, that's awesome. And the same concept is biting surfaces, upper, lower, straight across. We give the patient water, okay, to drink and rinse and spit into the emesis basin. Okay, once the area is cleansed pretty well, I'm going to assess and make sure that the oral cavity is cleansed. There's no breakdown of the skin. There's no bleeding of the gums. or any tissue in the oral mucosa. I'm going to pat this area dry, and then I am going to apply, again, lip ointment to the lip area, okay? So that's pretty much it with providing oral care. Just remember that you want to promote patient involvement as much as possible. Also, if the patient does have a full mouth of teeth, then we want to assist them in flossing. Flossing is very important in preventing cavities. So encourage the patient to floss, okay? Alrighty, and you would also document what you noted in the oral cavity. If there's any breakdown, any lesions, any broken dentures, all that will go in your documentation. How did the patient tolerate the brushing of the teeth? Did they assist? Okay, so all of that needs to be noted. If the patient is unconscious and you provided oral care, note any movement or how the patient tolerated the brushing of the teeth. Okay, all right.